Hello, my name is Frank Gleason. I'm a general surgery resident at UAB. The title of our talk is Patient, Medical Assistant, and Nurse Perspectives on Informed Consent and Decision Aids in Inguinal Hernia Surgery. I have nothing to disclose. The PI of this project, Dr. Abhishek Parmar, received funding from the SAGES 2018 Career Development Award for this study. Inguinal hernia repairs are one of the most commonly performed surgeries in the U.S., with almost 750,000 occurring each year. Although it is common, decisions regarding risk, operative approach, and timing of surgery are complex. The informed consent process is a crucial time for physicians to explain these complexities to patients. Unfortunately, prior work has shown that the informed consent process is inadequate, with patients frequently reporting a lack of understanding of details regarding the procedures. The implementation of decision aids in the clinical practice may help address this problem. We sought to characterize patient, nurse, and medical assistant perspectives on the informed consent process to guide the creation of a decision aid for inguinal hernia surgery. We identified patients who underwent hernia repair at our institution over a 1-year period and stratified these individuals by race. We next identified nurses and medical assistants to care for these patients at our institution. Trained interviewers conducted focus groups with these individuals. The interviews were recorded, transcribed, and coded. Analysis was performed using SAS and in vivo software. Focus group participants included 16 patients, 3 nurses, and 3 medical assistants. The first theme that emerged was the informed consent process, with 2 sub-themes as patient experience and suggestions for improvement. The second theme that emerged was decision aids. 2 sub-themes from this were role and format. In regards to the patient experience, the focus groups discussed each provider's role in education, that alternatives to surgery may not be provided, and the presence of information overload in a stressful situation, as indicated by this quote that points out the shock factor and a need for more time to process information. Suggestions for improvement include allowing more time to reflect, improving readability, and incorporating visual aids. The discussed role of decision aids was to provide information before clinic, help with decision making, and address questions. This quote points out that more information allows for an easier decision-making process. Suggestions for decision aid format include being available on multiple platforms, having reader-friendly information, and being free to use. In conclusion, we found that stress and information overload were identified in the informed consent process by patients, medical assistants, and nurses. Insight from key stakeholders is critical for designing interventions to improve this process. A decision aid with user-friendly content available on multiple platforms can inform the consenting process. Thank you for viewing our presentation. I would be happy to answer any questions that you may have.